Hi, I'm Dr. Gaurav Malik. I'm presently the head at Max Dental Care, which is a part of Max Super Specialty Hospital at Mohali. I'm a certified periodontist and oral implantologist and trained with digital smile design and various dental treatment modalities from the pioneers and giants in dentistry. My vision and mission has always been evidence-based dental care, which not only involves the right skills and the professionals, but the right infrastructure and the patient's comfort and convenience. What we look for are the patient's individualized, personalized plans. As vision, I feel it's constantly changing because of the kind of science and the kind of trends changing. We always upgrade ourselves, and with newer things coming, it's not just about providing patient dental care, but it's more about satisfying patients' physical, emotional, and social well-being. We have made our practice full spectrum, where we are not only able to offer individualized and personalized care, but we are also able to offer hope to those in need. Now, what sets us apart? I think what sets us apart is the segregation of the dental needs into the four broader categories. The four broader categories, I would say the primary is a hospital-based dental care. Now, in hospital-based dental care, we are not only dealing with the special need group, but we are also trying to cater to patients who are medically compromised. People who have cardiac issues, people with liver, kidney, and other problems are taken care in conjunction with all the protocols and consent by the specific and the specialist doctors. So this includes people who might need extraction and have cardiac issues, who are on blood thinners and various medications, and can be taken care in a safe and a sound manner. The further groups under the medical care or the hospital-based care involve the kids and seniors or adults with special needs. Here we have people who are mentally or physically challenged, where care is taken in the most medical protocol way under supervision and mostly under sedation and general anesthesia. The next category here comes the trauma care, where we take care of all the maxillofacial injuries, whether it's the upper jaw or lower jaw fractures and related injuries, which are taken care in the most coordinated way. We have emergency facilities for that, indoor admissions right from your ambulance to take you to the hospital, and to be able to provide you the world-class OTs and a complete team to take care of all your traumatic. The next category comes here of patients in need of rehabilitation and reconstruction. Now, these patients can be oncology patients, patients we diagnose with certain oral pathologies or cancers and who need further surgical intervention and reconstruction or rehabilitation. The next group here are the kids right from infants, toddlers to up to teenagers, kids who are not cooperative. So we made a very special protocol with our periodontist, a pediatrician, a pediatric anesthesiologist to be able to handle such patients under sedation and general anesthesia. Our next clinic is what I would describe as dental solution, which anybody and everybody as a part of the family would need. So in dental solutions, I'd had a passionate run with oral implantology and have made various protocols to suit anybody's need, right from single tooth rehabs to fixed multiple implants to full arch solutions. Whether you require a complete teeth if you're edentulous are all possible. So we have made all on 4, all on 5, all on 6 concepts to even teeth or tooth in a day. Now, all these modalities, I like to be sure that what is the patient's best need, and it's in accordance with the patient's expectations and of course the clinical limitations. My certification and my post-graduation in periodontics makes me do all the gums and the bone procedures, and I work on a lot of regenerative protocols of bone grafting procedures. My further strengths, I would say, are in the use of lasers, which we are using for various dental procedures, root canals, laser assisted, as well as all sorts of crown, bridge, veneers and laminates have been a strong forte. Here I would like to introduce you to our third clinic, which is Dental Visage. Now, Dental Visage is all about personality-based smile designing. Here I make sure I take a lot of digital records and I'm able to show the patients beforehand how their smile would be. Now, this smile designing can include use of crowns and bridges, various sorts of veneers, laminate, lumineers, thinniers, not to limit myself to various gum surgeries to take care of your gum recessions which look unesthetic, or for your dark gums. So a wide range of procedures which are required aesthetically and cosmetically is what we offer, and it also includes certain orthodontic modalities. Right, the latest one is clear aligners, which are invisible and cause and can correct all your malocclusions. The next concept we have worked on is speed dental, which is specifically good for people who are outstation or maybe international patients who are short on time and yet want the right solutions. These solutions are scientific yet quick. How does it happen? Now here we dedicate our entire team to the patient, maybe give them longer hours during each day, and make sure most of their work is completed in minimum time. What else sets us apart? It's here where I like to mention that we are the NABH accredited clinic, where we follow all world standards, whether it's universal precaution, whether it's the radiation protocol, and the waste disposal modalities. Our sterilization is world class and hospital grade. We make sure that the patient does not only get a good treatment, but it is as safe as possible. I'm also very confident about my entire staff, which I feel they are all as passionate as myself. Now these include all the specialists of my team, the graduates, and the support staff. All of them have their own important role, and each one of them contributes greatly to the patient's satisfaction and care. Here I would like to mention that the patient care not just only consists of being in the clinics, but we as a team spend a lot of time out of the clinics. It's about case discussions so that we can plan the best possible outcome and the best possible treatment plans. A lot of time is spent in the laboratories for planning of cases, for planning the right prostheses and the appliances so they can be delivered not just on time but as effective and as best as possible. So I would like to say that we believe in technology, we believe in the right infrastructure and all the skilled professional, and where we feel that the reward is simple. Our patients keep coming back for their needs, they keep referring their family, friends, and all of them thank us for the great contribution we got in changing their lives. We have better, happier, healthier patients, and that's the best reward as a professional I can have. Being a perfectionist, I feel that I like to go to the tiniest details to make sure each patient experience is world class. For that, we keep innovating, keep adding skills, a lot of knowledge, right professionals, and the right infrastructure. Now, what all I get out of this? Well, the reward is simple. We have patients who keep coming back for all their needs, keep sending family, friends, who just thank us for the change we brought into their lives and how we have made them healthier and happier. So I would say that everyone needs such kind of dentistry, and my question is, don't you? Yes, if you do visit us regularly for your needs, and we'll make sure we offer you the best options possible.